October is Breast Cancer Awareness Month. It was created to promote screening and prevention of the disease. And according to breastcancer.org, every year, 1 in 8 women here in the U.S. is diagnosed with breast cancer, and 2.3 million women are diagnosed worldwide. Here to tell us more about it is Dr. Fauzia Riaz from Stanford Health Care. Thank you so much for joining us, Doctor.
Hi, yeah, thank you for having me. I think this is an incredibly important topic.
No question. It's amazing how many women are impacted by this every year. What are the symptoms we should be looking for when it comes to breast cancer?
So, I think what we used to tell patients is that, self-breast exams are incredibly important. But what, we found is that self-breast exams are tough. And so what I do end up telling patients is, it's important to have self-breast awareness. So what's normal for your breast tissue? And if you notice something that doesn't feel right or look normal to you, whether it's a lump or changes in the skin, such as, skin dimpling or red flaky skin or nipple discharge, those are things that you want to bring up with your doctor. And that's really the key, right? Is to see your doctor on a regular basis, getting in, whether it's your primary care provider or your gynecologist, for that clinical breast exam at least once a year, and getting your mammogram when it's due.
So what are the biggest risk factors when it comes to breast cancer, and can people do anything to lower their risk?
Yeah, no, I think that's a great question. So biggest risk factors are going to be things that, so we kind of categorize them. Are there things that are modifiable and things that are not modifiable? So, age over 50, family history of cancer in general, those are things that, we can't really control, but there are things we can control. So like, there's alcohol intake. So greater than a drink per day is associated with a higher risk of breast cancer. BMI, so obesity in general, is actually associated with an increased risk in breast cancer. So we say, maintaining a healthy diet, healthy weight is incredibly important in reducing your risk of breast cancer.
And when you mentioned earlier about getting those mammograms, what age should women start doing it? Is it still 40 or is it a little bit older now? When do you think is the right time?
Yeah. No, that's a really great question, debated. There are different societies that have different recommendations, but what the American Cancer Society recommends is that, women between 40 and 44 have the option of getting an annual mammogram, but absolutely starting at the age of 45, women should be getting at least a mammogram once a year.
Okay, that's great advice. All right, lastly, breast cancer mostly impacts women, but it also impacts men too. What can they be doing to be diligent about their health when it comes to this?
So breast cancer, you're right, absolutely. We think of women, but men men are a population that are at risk as well. About, the less than 1% or about 1% of all breast cancers that are diagnosed in men. But men aren't getting mammograms on any sort of regular basis, of course. So if you're a man and you feel a lump in the breast, again, similar symptoms, if you notice anything abnormal, that's when you bring it up to your doctor.
Yeah, such great advice. All right, Dr. Riaz from Stanford Health Care, thank you so much for this invaluable information. Thank you.
Thank you for having me.